All right, it's time for our Kegel exercises, Twila.
Yes, it is.
And so why do we do our Kegels? Well, it's important for our pelvic health for both men and women. It helps, these exercises help support our pelvic organs in women, the bladder, the vagina, the rectum, the urethra. And for some people, it can actually improve sexual functioning. Some people say it makes orgasms more intense and more frequent.
Well, I think that's a good enough reason to do them right
Nobody's going to
there.
argue with that, I don't think. So let's go ahead and do it.
Okay. 3
Times a day.
6
Days a week.
9
Seconds per Kegel.
and 12.
Kegels in a row to make a rep. It's so easy. Just do 12 of these 3 times a day. When you're doing them, hold it for 9 seconds. You will be the envy of your neighborhood. You will have a pelvic floor like a chain link fence, so you will be able to pull a trailer.
If you so choose. And don't forget, you can always go to the GynoCast Facebook page and get an infographic, which kind of details out the customizable plan. You can print it out, put it on your fridge. You can put it up in your office. We can share it with your friends. And it's a great resource to have. So
Indeed.
Make sure that you go and do your exercises today.
Yes.
Stay tuned.
Hello, everyone, and welcome to the GynoCast. My name is Dr. Eric Heegaard. I'm going to just say it. I'm a board-certified obstetrician and gynecologist, and I'm sitting here with my beloved partner and sitting looking at her, talking to her. Who are you?
Oh, I'm Twila Dang. That was nice.
Well, that's true. We've been friends for a while now.
I know, right?
And it's so nice to be. I just love doing this with you. I love being. This is a great excuse to be able to hang out.
You know, I got nothing to say. I just feel all happy now.
Warm and fuzzy.
I know. I feel special.
Well, so if you're new to the GynoCast, welcome aboard. We are so happy to have you here
Yes.
to talk about the important subjects that we talk about. And if you are a repeat listener, we are, I don't want to say even more appreciative, but in a way we kind of are, because that means you liked what we gave last time. You're coming back for more.
I just like when anybody shows up. So if you've been here before, thank you. If you're new, thank you and welcome.
Exactly. Are we doing our gratitudes today?
I guess. So we're having a where's your gratitude journal? I feel like Oprah.
So for people who don't know what we do here, what do we do?
We talk about anything and everything women's emotional and physical health and well-being.
That's right. And that's a broad net that we cast.
Yes, we do, but on purpose.
Exactly. Yeah, exactly. And so we talk about things that a lot of times people want to know about. Maybe they don't know where to go. Mm-hmm. And sometimes these topics can be embarrassing or sensitive and maybe not things you want to talk about with your mom or your dad, for that matter.
True.
Or maybe you don't want to talk about it over cocktails, martinis, dirty martinis. Like, I don't know, Twila.
No.
You're so clean living now. You don't do anything like that anymore.
I drink whiskey.
Well, that's vegan, I suppose. So are cigarettes, I believe, aren't they?
Close enough. I don't smoke.
I know, but you could, as a vegan, you could smoke.
Yeah, tobacco is vegan.
You could chew tobacco. Okay, you could engage in many.
Don't email me either. You know you don't want to smoke either. Stop it.
Now I don't know where we're going. We talk about things that people need to talk about, and sometimes don't know where. And so what I always say is, don't Google GynoCast. Oh.
I'm just going to leave that right there because I still haven't figured out. I'm desperately trying to figure out some phrase you can say so you don't keep saying GynoCast. Oh.
I know. I haven't figured it out either. So we're going to talk about a topic today that is one of these topics that I think people are talking more about. That's incredibly important, not necessarily conversation that is
it's a little tough.
Company.
Yeah, it's a little tough.
It crosses a lot of different lines in many ways. We're going to talk about female genital mutilation. Why? Well, because it happens, and it's happening all around us, and it's. If you don't know this, the GynoCast is based out of Minnesota, and we had something in recent months of a case where some young girls were brought to another state where they underwent female genital mutilation.
Yeah, I think the thing that was most startling about some of the news that's come out recently was we tend to think of this as something that doesn't happen here.
Exactly.
We think it happens in foreign countries. We think it happens in other places. We think it's far removed from our experience. And then to have that happen and hit the news and realize that, no, it is happening here. There are people that are engaging in these practices right here in the United States. It was a little startling. It was very jarring. And it made me very determined to go find out more about, what it is in full, like beyond what I think my understanding of it is. Because I think we all tend to have sort of what I like to call a news ticker understanding.
Yeah.
Of things where we see a story on like a morning show or we read a blurb online and we think we understand the issue when we really don't.
That's right. So let me give you some basic information here. So this is from the World Health Organization.
Mm-hmm.
So what is female genital mutilation? And that comprises all procedures that involve partial or total removal of the external female genitalia or other injury to the genital organs for non-medical reasons. And so, as we talk about on the GynoCast, anatomy is important. So what is the external female genitalia? We're talking about the labia, which are the labia minora and majora, which surround the opening to the vagina, which is the tube that goes from the uterus to the outside. There's the clitoris, and then the surrounding tissue around that, the mons pubis, which is where the pubic hair is, etc. That's the external genitalia. And so female genital mutilations involves altering that. And just some interesting tidbits here. There are more than 200 million girls and women alive today who have had this sort of cutting. They call it cutting. And in more than 30 countries, mostly concentrated in Africa, the Middle East, and Asia. But as we've heard, this is happening here in our own backyard in the United States as well, in Western countries. And so the purpose of the show is, I try not to say to pass judgment, but I am. I think that I will say this, that
okay.
Let me clarify here.
Yeah.
Okay,
he sees that you don't, this is not a visual medium, so you don't see me raise my finger and go,
well, because it's hard because we want to be, we are a country of immigrants. We need and want to be welcoming and understanding of people's different cultural beliefs. But at some point you have to say, we respect you, but you cannot do this. You can't marry your 10-year-old child to an 80-year-old. It's not legal. We have some boundaries. You can't perform.
Okay, you have to be careful though, because that's a very wide brush that can be painted to say that only happens in certain populations or in immigrant populations. That can happen.
It can happen anywhere.
Yeah, so we have to be you're
right, Twila.
Thoughtful about the idea of in talking about this in particular. I think we're trying to establish a base that says we understand that there are different cultural sensitivities, but that hopefully we can all agree that on the whole, the idea of taking a young girl or a young woman and removing any part of her genitals for a purpose other than medical feels
right.
Feels wrong on many, many, many levels. And if we can't do anything but agree that this shouldn't be happening without them being able to consent or decide for themselves they want something like this done.
Yes,
is to me not only heartbreaking but should be criminal.
I agree, and so I'm not arguing with you. I'm agreeing with you.
Yeah.
But the thing is that we have laws in this country.
Yes.
And laws that there are egregious things that are happening to children everywhere. Including, child pornography, not legal. We don't have to probably, to people coming into our culture who may be new to it, have to say, well, this is not right or wrong. This is not right. People, I think, pretty much know it. And also, these are established laws in the United States. And so, but from cultures where female genital cutting or mutilation is a fairly common practice, I think, as with other things, you have to say that in our culture, this is not legal. It's not tolerated, and make sure that is clear, that we are a culture that does not support this sort of thing.
Well, do we need to maybe establish sort of the background as we understand it of why this practice happened?
Absolutely. And so there's different forms of female genital mutilation. And so there's type 1, type 2, type 3. Type 1 is actually almost like the equivalent of a male circumcision, which is actually just removing a little bit of the clitoral hood, the skin overlying the clitoris. So there's not really any damage to underlying tissue.
So, but what is the purpose?
That would be probably that's more just sort of.
Is it just more cosmetic, or is it?
I think it's more just sort of cultural in terms of this whole spectrum of.
Like a rite of passage, or
a rite of passage. There are people that believe that there is some hygienic aspects to it in terms of removing this tissue.
Sort of like how circumcision
works.
Okay.
Right. And also, historically at least, it's been a way of controlling women's sexuality. if you remove the clitoris, well, there's less sexual satisfaction, sexual pleasure, and it has been thought that you could control what the young woman does if she doesn't have this.
Right, remove the ability to have the urge, and there is no urge.
Right, and so the type 1 is just a small little removal of clitoral skin, which is not really probably anything that causes any issues as long as it goes without a complication.
Mm-hmm.
Type 2 involves removing part of the labia, or all of the labia, or part or all of the clitoris.
Oh.
And then the third type is the most severe, where they do all that, and then they actually sew the labia closed for the most part, basically covering the whole vagina. And so the vaginal opening, I saw somebody about 3 or 4 months ago, a woman who came in who was in her 40s, and she had some other issues, was just a wonderfully smart, engaging person who obviously had this as a child and had immigrated to the United States 20 years ago or so. And she had a opening into her vagina that was about the size of a pencil.
Okay, see that I don't, and this is, and mind you, I'm fully embracing and admitting and putting out here in full my full tilt American feminist woman self.
Yeah.
When I say I don't understand the logic in doing this on any level. What purpose does it serve to leave her with an opening the size of a pencil?
Well, and this is where it gets complicated when it starts. It's a complicated conversation because now you're starting to talk about, in some ways, being critical of certain cultural practices.
Yeah, and I'm not trying to do that. I don't.
And
yeah,
it's hard, and that's the thing, is that there is no medical reason for it. There's nothing that's the idea that it's more hygienic to have this done. Not true. You can use your own imagination. The
Right.
only reason to do it is to control a woman's sexuality. That is it. You cannot have sex with a hole that's the size of a pencil. And I'm talking, the average number 2 pencils.
Yeah.
What's that diameter? 8 millimeters or something like
well,
that?
I mean, I guess, and that's part of my complete not fully understanding the purpose of this, because if the purpose is to control women's sexuality on one level, on another level, don't you still want them to be? I mean, are you trying to eliminate their ability to be wives, to be mothers?
No, and so that it depends on the severity of it. But this way it allows the husband to know that his wife is a virgin, and then they open up that opening.
Okay.
With something
Right.
Sharp.
Yikes.
And so, or it breaks open at the time of intercourse, which is be very painful. So, and so it's just there are parents, this as well as I do,
Yeah.
Twila. No matter where you are in the world, you love your kids. People do this because they think it's the right thing to do, that it offers their children advantages.
Well, it's historical and it's
Exactly.
passed down. I mean, we have traditions here that have been passed down, and
Precisely.
maybe not sort of physical traditions in this respect, but we do. I mean, we have the debate here about circumcision and whether it's necessary or required.
Yeah.
And in many respects, we all have cultural traditions that we have passed down repeatedly, that at some point people question it, or at some point social norms change and those traditions change. This just happens to be something that is far more deeply entrenched in the cultures that it comes in from.
That's right. And it's and so it is really it's a very hard thing to see, and these women tend to be, the hard thing too is that they tend to be embarrassed by it, oftentimes, most of the time, not all the time.
Mm-hmm.
But, so I've had, I don't think I've ever had anybody ask me to put it back together again. And sometimes we take them down.
Okay.
So open it up. At the time of childbirth, of course, it's going to tear. And so that can be, and at the time, given how restricted it is.
Yeah.
And so I don't believe I've ever had any woman ask me to sew it back up. But the political stance on this is from a woman's rights perspective, is that if a woman has a circumcision and the opening of the vagina is scarred closed, for example, and either you open it up for one reason or the other, if she requests to have it closed again, we're supposed to do it. And that's her right. It's her body.
Right. Yeah.
But the issue really, of course, is that these procedures tend to be done on children, virtually always children, less than 15 years old. They tend, in other countries, they tend to be done in situations where they may not be anesthetic and not terribly clean. And that's just assuming if you want to just do the procedures correctly or in a safe way. That has nothing to do with whether you should do them at all, which is no.
Right.
And so, it really is. It's trouble. And the interesting thing is that it tends to be performed by the women in the family or the group. And so, oftentimes there can sometimes be celebrations involved, sort of as a rite of passage.
Right.
As you said,
Right.
But stories I've read at least is that it can be very terrifying, and that the children are taken. They don't know what's going on, and of course, it's extremely painful and dangerous. And so, there can be immediate complications such as pain, bleeding, tissue swelling, fevers, infections, of course, poor wound healing. And, there have been situations where children actually die. The issues, but, even beyond that, the long-term complications, issues with the bladder, issues with vaginal infections, the ability to pass menstrual blood.
Oh, yeah.
And this, it's sexual problems, of course. And then when you get into, as people move from one society to another, of course, there tends to be, at least my experiences, and I've read about this too, that there can be a sense of shame in women in this country who, having now been exposed to other options, realize that they don't want to do this to their own children, for example.
Right, which creates sort of a a psychological crisis.
Exactly.
In that respect.
That's right. And also, it can lead to a barrier between these women and seeking medical care, because they may be embarrassed to come in. They may not feel comfortable with perhaps being judged by the medical community.
Yeah.
And so it really is. It's a very difficult thing, and it's hard enough to be dealing with women who've had this done on themselves, and the complications related to that. But the really difficult thing is when you see this being perpetuated again on another generation, when we really should all be knowing. We should all know better. And again, I want to emphasize there is no medical benefit to this. None. Only risk of complications and only damage.
I think that's the most important thing to point out, is that there's no medical benefit in having this procedure done.
No.
I already have a hard enough time wrapping my brain around it as a woman, and I'm somebody's mom, and the idea, I am a mother of daughters, and the idea that on any level, I would put my daughters at risk of heaven knows how many complications, or just the pain of, something like this, is something that is not just abhorrent to me, but completely foreign. It's not a part of my makeup. It's just not a part of who I am to be able to do this.
And of course, because for you and for most of us in our culture here, we see that there's no benefit to the daughters. But in other cultures, historically, it protects them. It allows them to be married.
Right, and the thing is, I think that's where the real sort of dichotomy of thinking comes from, is the idea of how do you go about understanding this without assigning a very large scale sense of sort of indignation and anger at people in a community when you logically understand that they think they're doing the right thing.
That's right.
Sometimes it's easy to see something you think that you would personally consider, unjust or evil, and go, that's evil. And you can see, and on the surface, it's just black and white. It makes sense. On one level, it makes sense. You don't put a child in pain. You don't put a child through this. That just makes that part of it very black and white. But then you get into this very odd gray area of, in this culture, if this doesn't happen, what happens to that child?
Exactly.
In this culture, what happens to a woman or a wife or a mother who refuses to do this to a child, or who refuses it for themselves? How does someone who, in many of these countries, who isn't allowed to get beyond, an elementary education, if that survive, if they're cast out or put aside, or publicly marked as having not gone through this? I mean, there's so many odd, terrible, social complications that play into this as well.
That's right. And so, it's important for us to be understanding of this, and from a medical standpoint, for practitioners to know what's going on and the possible complications related to that. But I think from an education standpoint, it's important that we say there is no benefit to this, only harm, from a physical and medical standpoint.
Mm-hmm.
And also, as a culture in the United States, I think most of us like to think that we are moving forward in terms of greater freedom and greater equality for genders and different people of all races, that we all hopefully can get equal opportunity. And so I think it's important that we educate ourselves and people who are coming here that this is not legal, and that the repercussions in terms of parents who do this and doctors who perform the surgery, which is what's happened to these doctors in this other state.
I think that's
that are truly criminal. This cannot be a slap on the hand.
Yeah, that's huge. The idea that if it's happening in the United States and these are doctors who are operating under United States guidelines, under our law, and doing something that is outright stated as being criminal in the United States.
That's
right.
If
you're doing this and they catch you, and I hope they catch every single one of you, then you need to
lose your license and you're going to jail.
You throw the entire book at them.
Right.
You make sure that you make it as non-advantageous as possible to continue to attempt to do this.
That's right. And also in different communities where there may be more likely to have this done, it's important that people communicate with each other. And I think we've seen that there's been a lot of activity among certain communities as they're trying to themselves say, we do not agree with this.
Mm-hmm.
We do not agree that this should be done to our children. And so it's not like, at least from what I've read, there's a lot of resistance among different immigrant communities or communities that aren't immigrants here in the United States that are agreeing that this is not a benefit.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
Now, I think it's really important sort of at this juncture of the conversation where we've laid out a bit of the landscape to kind of talk to our benevolent friends out there, because I know you. I can be you at times. You think you know something, you've learned a little something, you're indignant to the point of wanting to take action. You need to be very careful and thoughtful about how you take action. Action can be working with an organization. Action can be donating to an organization that knows how to engage these issues. Action is not deciding on your own that you should personally educate somebody that you think might be involved in this. Or if you have information that you think someone is doing this or has done this or has been engaged in this, that you feel like you need to swoop in with your white cape and educate them on their culture, educate them on what's the right thing to do.
Yep.
Not your place.
That's
It's absolutely not your place. Part of being a good human is being an empathetic human and understanding that while you may know something, intellectually, you may feel something emotionally, it might not necessarily be your place to interject yourself into a situation.
That's right.
A lot of times being a quote unquote ally means being supportive of an issue without inserting yourself into the middle of it as the savior of the issue. And that's super, super important. And I know this is a lesson I personally try to make sure I practice all the time. I have so much knowledge from working on the GynoCast. I have so much knowledge that I didn't have before from working with Dr. E, that it can be very easy to find myself in situations where I'm saying, oh, well, I think that's this. You need to go do this. Not my place.
Yep.
Be supportive. Be a listener. Be an active participant in organizations who understand and have created a structure that will actually impact change. You can't necessarily don't be that one person riding in on a white horse with a bunch of opinions and no ability to act.
That's right.
It's super important that you turn your empathy ears on, that you go get educated, that you understand the landscape. But if you really do feel compelled to act, take the next step and act in the right way. Yeah. Don't just jump in and insert yourself into situations or insert yourself and insert your opinions in particular into situations. Do your research. Google can be your friend sometimes. Research organizations. Go find somewhere where you can help. Ask people that you think are knowledgeable how best to help in a situation like this. Don't just decide. I mean, I think a lot of us make the mistake of being sort of armchair therapists and armchair experts at things, and that is not our role. Even my role here on the Gynocast as being the quote-unquote big mouth girl with opinions ends at the point where if I really believe in something and I really want to affect change in something, one, I'm lucky that I get to be in an environment with you, an educated, knowledgeable doctor about health issues. But I do take it a step further. I will go find an organization if I feel compelled and volunteer. When we put things in the syllabus, I make sure I read the things in the syllabus and follow up and ask those questions. If I'm going to put my money behind a cause, I will make sure I vet that cause and make sure that it's something that I really believe in. There are very simple, everyday ways you can help in these situations if you really believe in them and you want to help. But the worst thing that you can do is decide that you know better than everybody and become super benevolent in your opinion and try to enforce or impart your will and your opinion on other people without fully understanding situations.
That's right. And we're in our syllabus about the show, we'll have resources that you can go to.
Yeah, absolutely.
So there's a couple more things I want to just address before we close this out. I want to tell a few stories just to kind of illustrate kind of what a little bit more about this. So one is I just want to fill in this patient I was talking to you about. Mm-hmm. This woman comes in, she had some abnormal uterine bleeding, which requires being able to sample the inside of the uterus because it could be cancer.
Right.
And so as we're talking, she discloses to me, she said, I've had a female genital circumcision, and so we do her exam, and I find, of course, that there's the opening to her vagina is the size of a pencil eraser. And so, and then she gets dressed and we're talking, and obviously we're going to have to figure out how we're going to kind of work around this. But, and I ask her, well, how do you evacuate menstrual blood? And she said it just pools there and kind of leaks out. Oh. And additionally that urine is the same way. Her urethral opening, she urinates, it's basically a little sac. So she urinates into this sac, and then that leaks out this little hole, and so does menstrual blood. And you can just imagine in your mind the potential complications related to that.
That breaks my heart.
Yeah, urinary tract infections, perhaps uterine infections, vaginal infections, pain, and obviously the difficulty in terms of sexual function. She had never been sexually active. We spent quite a bit of time going over anatomy, and because I had to tell her how we would try to get into her uterine cavity, which would involve having to open up the part of her where they had the labia minora, the small lips surrounding the vaginal opening, were sutured together. You have to open that up so you can get in there. So we had to talk about just the anatomy of normal external genitalia, including the clitoris and that sort of thing. And I was so impressed, and I don't mean to sound this, and it almost sounds a little patronizing, but she was so engaging in terms of wanting to learn and curious about her own body, which is what we try to do here on the Gynocast. And so on her exam, there was I could feel that there was part of the clitoral shaft that was still present. And so, and as you know, the clitoris is actually much bigger than we. It actually extends, kind of back like the shaft of a penis, and that extends kind of in a Y-shaped formation along the pubic bone on either side. So I told her that I thought that she had remaining clitoris, that she could probably have pleasurable intercourse if that's what she chose to do. Mm-hmm. And so we talked about how we were going to open things up, and I said, would you, do you want me to put it back together? And she said, I think she may have actually said this, hell no, And so the reason I bring this up is actually to have people try to imagine what that is like to have that done to your body. You're not urinating out of your urethra. You're urinating out of your urethra into a sac that's been created, and it's dribbling out the bottom from a small hole. Menstrual blood is coming into there. And then how, if you were in a relationship and you wanted to be sexually active, how would you do that? You would have to cut that open. And I can tell you that, in more traditional societies, they don't have lidocaine or novocaine. It gets cut by whatever sharp thing is available.
Well, yeah. I mean, and that's,
it is hard, but we just gotta. And so the reason I bring this up is that for women who've had this procedure done, it can be reversed, meaning you can open up the opening, and you don't have to sew it closed again unless the woman wants. And also, for people who think, well, there's no possibility of any sexual satisfaction because the clitoris is gone. Well, oftentimes there's part of the clitoris that's still there, and so these women may be able to have, a satisfying sexual relationship, even though they've had this procedure performed. And as we know, sexuality is complicated anyway, and it's not, people enjoy sexual intimacy for a lot of different reasons.
Well, I feel like what you're saying overall here is that even in situations like this, that there, that there's still hope in these situations.
Yeah, absolutely. And so there's things to be done to help rectify some of the issues they may be causing. So, if you've had this done to you, please get in to see your provider. We have, those of us who practice in women's health and do, who are gynecologists, we have seen everything, including what you have had done. And we will talk to you respectfully about it, about how to follow your wishes and try to make things the way you want it to be and manage your health care. And so don't be afraid of us. But the only thing that I would suggest is, as we talked about at the beginning of the show, this is not something you want to perpetuate on the next generation. Now, let me read what the Women's World Health Organization says about female genital mutilation, and we'll end with this.
Okay.
At least I'm going to end with it, unless you have something else to say.
I will defer to you, sir.
Female genital mutilation is recognized internationally as a violation of human rights of girls and women. A violation of human rights. And I'd like to think that we still care about that. It reflects deeply rooted inequality between the sexes and constitutes an extreme form of discrimination against women. It is nearly always carried out on minors, and it is a violation of the rights of children. The practice also violates a person's right to health, security, and physical integrity, and the right to be free from torture and cruel, inhuman, and degrading treatment, and the right to life when the procedure results in death. And so, look at our syllabus. You can get more information on this. It's important to educate ourselves and to be respectful of people who have different beliefs. And so, but we got to put an end to this. So please, I think we talked about our Facebook group, so we don't have to beat that dead horse anymore, do we? No, ma'am.
Let's not call it a dead horse. I don't think it's exactly.
Well, I don't want to beat a live horse. That would be cruel.
I don't want to beat any horses. How about that?
That's true.
I just say, if you haven't done it, we did talk a little bit at the beginning of the show, but if you haven't joined and you'd like to, just go to Facebook, type in the Gynocast.
The Gynocast.
And then you can ask to join the page. We'll vet you very quickly. You'll be a part of the wonderful discussions, the support group that is provided there. You can even ask questions of us for the Gynocast show by clicking the send message option and putting out your questions there. If you need a little more anonymity, that's probably the best option for you. Otherwise, we appreciate it as always that you're listening, and we appreciate all the support.
Please cast a wide net. Expose the rest of the world to our little family, the Gynocast. Become part of the family if you're not part of it now. And let's get everybody involved. Let's make this world a better place for everybody.
Absolutely.
But we have to start with women, because that's what the show is about. But we all know, Twila, you know this, and I know this, that healthy women make for healthy families. Healthy families make for healthy cities and towns and societies and a healthy world. It has to start with it. Educated women, we know this. If you educate girls, everything gets better.
Absolutely. Well, thank you so much for listening. We'll see you soon.
Thank you.